Imagine a world where brain surgery was performed without modern tools, yet patients survived and thrived. A world where skilled herbalists could remove skull fractures and brain tumors using only nature's remedies. This world existed in Africa, centuries before Europe even grasped the concept. But why don't we hear about it? And how did European explorers misinterpret these advanced medical techniques? Stay with us as we uncover Africa's lost history of brain surgery. Africa has long been a center of advanced medical knowledge. From the Kingdom of Egypt to the Great Lakes region, African healers possessed deep knowledge of human anatomy and medicinal plants. Historical texts from Egypt mention surgical techniques, while traditional healers across East and West Africa practiced trepanation, an ancient form of brain surgery. These practices were not random. They were guided by precise knowledge passed down through generations. Healers understood how to relieve pressure from head injuries, extract tumors, and treat neurological disorders using only natural anesthetics and antiseptics. But is there physical proof? Absolutely. Excavations in Kenya, Uganda, and Tanzania have uncovered ancient skulls with neatly cut holes, clear evidence of trepanation. What's remarkable is that many of these skulls show signs of healing, meaning the patients survived the procedure. In Egypt, skulls dating back 4,000 years show similar evidence. Researchers believe these procedures were done to relieve head trauma, epilepsy, and even mental illnesses. So, how did they do it? The process was intricate and precise. First, the healer would prepare a potent herbal mixture containing plants known for their sedative and antibacterial properties. Alcohol or fermented palm wine was often used as anesthesia. With the help of assistants, the patient was restrained, and the healer carefully cut into the skull using sharpened stone tools or metal instruments. Once the skull was opened, damaged or infected tissue was removed. Herbs were then applied directly to prevent infection, and the skull was secured using tightly bound strips of palm fronds or leather. Patients would recover within weeks, showing that these healers had an advanced understanding of post-surgical care. To African societies, these healers were highly respected figures. They combined surgery with spiritual guidance, ensuring both physical and mental healing. But when European explorers first observed these practices, they misunderstood them. Instead of recognizing the medical advancements, Europeans dismissed these healers as witch doctors. They failed to see that these herbalists were highly trained specialists who practiced one of the earliest forms of neurosurgery. During the same time period, Europe was still using techniques like bloodletting and leech therapy to treat illnesses. Brain surgery in Europe was rare and often fatal due to poor hygiene and lack of anesthesia. Meanwhile, African healers had survival rates that stunned modern researchers. While European surgeons struggled with infections, African healers had already mastered the use of antiseptic herbs and natural anesthesia. So why was African medicine erased from history? Africa's contribution to medicine is undeniable, yet often ignored. The fact that ancient Africans successfully performed brain surgeries long before modern medicine challenges the narrative of African societies being primitive. What do you think about Africa's lost history of brain surgery? Should more research be done to uncover these ancient techniques? Let us know in the comments.